Yeah, Sandeep?
Yes, sir.
One
Can
second.
start, sir?
I will just put annotate. Yes, now we can start. Hello, doctors. Hello, students. Welcome to another class of our 90-day University Prof Pre-Final Mastery. So today we will be talking about our systemic bacteriology 3. Actually, the date today is 28. We just didn't change. It's okay. So today will be systemic bacteriology type 3. Another very, very important topics we're going to discuss here. So we are going to see all the rapid review of all important questions here. All quick revision of volatile topics and also high yield topics, most expected topics for your exam. Okay, not only for your prof, but also for your next exam, NEET, FMG, everywhere. It's going to be very, very useful. So now the next one is, you know that why to choose Auricle, all because of our recorded classes, live classes, practical exam module, and the hard copy things we have here. And recorded class are very flexible and it's going to give you very expert knowledge and convenient revision also. You can check that. And then live classes which we're doing now is going to be very, very informative and very good for you. And express exam module also, you'll be trained very well how to write the exam. Okay, complete the syllabus in just 20 hours. Answer writing skill, expert educator, everything will be taught here. It will be very useful. And then of course, one-to-one doubt clearing session is very, very important. It will be very useful. Hard copy sets are available. You will be provided so you can use it for your better, writing things and all important notes. And the question bank also a very effective question bank we have. You can see all 10 years different university exams papers. So it means it's more than enough. If you know the question bank, you will easily clear most of the questions. Exam is very easily. Practical session is also, it's going to be very interesting. We'll have it later. And then of course, these are the things we have. So we have foundation plan, advanced learning plan, complete learning plan, ultimate MBBS plan. So look at the prices and choose whatever is convenient for you. And you can use my code, this Dr. Santhosh Rajan 20 for more discounts. Okay. So now we're going to start the topic. Today it's more about Clostridium, mainly about it's an anaerobe, right? Anaerobic topic, Clostridium, and few more other topics also very, very important for exam. So we'll start. So first of all, the question is very simple. Classify the Clostridia and the pathogenicity and laboratory diagnosis of Clostridium welchi, which is the one which causes gas gangrene. Definitely one question is there in gas gangrene. There's most of the exams I've seen, there is not a question without gas gangrene. That's what we choose these topics very, very important for you. Okay. Now let's talk about Clostridia. Clostridia or Clostridium. Overall, it's Clostridia. So they role to classify. So before classifying, we know that Clostridia is basically anaerobe. Yeah, anaerobe. Another thing is it is a spore forming. It's a spore forming bacillus, spore forming bacteria, right? Along with the bacillus, but bacillus is aerobe. Bacillus anthracis we're talking. That's a aerobe spore forming. This is anaerobe. Close, no, when there is close, you remember when there is close, there is no oxygen, right? When anything is close, you have no oxygen. So no oxygen, which means it will die in the oxygen. Okay, without oxygen, it can survive only without oxygen. Okay, now types. Classification they told. So classification of types, this usually based on spores only, based on spores location only we can classify it. Okay, spores location. So how we are based on the spores location? The spores can be, first of all, it can be subterminal. I'm writing subterminal first. Okay, the first one is subterminal, or it can be terminal, or it can be central. It can be in the central part, right? It means the spores are like this. And remember, all these spores are bulging spores. We have this spore, they are bulging spores. All the spores are bulging. This also question, one more question, okay? Bulging spores, they will ask. Every point is important in objective questions, so they'll ask. So subterminal means if this is the bacilli, the spore will be here, subterminal. Okay, when you terminal means the spore will be in the end. So it will be like this, like this, or it could be like this. Okay, we have examples also. And this bifermentis, by central means it will be like this. The example is bifermentis. We're going to talk about that also. So these are the different type of spores. Now, how you're classifying it? Okay, when you talk about this subterminal, very most of them, most Clostridium or subterminal only. Okay, that's important. Most Clostridium. Terminal, two TTs will be the T for terminal T. So when you see this, it just looks like a tennis racket appearance, no, tennis racket appearance. Here, this one looks like a drumstick appearance. So you already guessed, okay, this is tennis racket, and this also question is there, asked frequently. In MCQ also it will come. So I'm repeating. Tennis racket means R is there. So this example is Clostridium tertium. Tertium. R is there. So tennis racket. Easy. Okay. Tennis racket. Tennis racket. Tennis racket. Okay. Drumstick. Drumstick is Clostridium tetani. When you beat with a drumstick, you make the sound tet tet. Okay, so remember like that tet tet tetani tet tet tetani. So both are terminal. T two T's have come, so terminal. Easy, you can remember like that. Central means center. So anything if you cut in the center, it means bi. No, it's the center. So 1 and 2 bi. So we call this as Clostridium bifermentis. Clostridium bifermentis. Finish. This is the classification. Okay, it's very simple classification for your Clostridium. So now important is Clostridium welchi. Question asks is Clostridium welchi. So we want to talk about the Clostridium welchi now. So now Clostridium welchi, Clostridium welchi. If you remember, this is also called as perfringens. It's also called perfringens. Okay, Clostridium perfringens we call. Other name is Clostridium perfringens. Okay. Pathogenicity and lab diagnosis. They asked only pathogenicity and lab diagnosis. So it's easy, not that difficult. First of all, you have to write few points about Clostridium. Clostridium is one unique in Clostridium. This is one unique one. You know why? Because this is the only capsulated Clostridium. Only capsulated Clostridium. And the only non-motile Clostridium, also only non-motile. This is the only non-motile Clostridium also. Remember, two things, okay? So only capsulated and only non-motile Clostridium. Fine. Now, when you talk about this is some basic point you're going to write, okay? This is a non-motile, capsulated, non-motile. This is first point you're going to do, okay? And of course, they will talk, the disease will come now. So the main virulence, when you talk about the virulence factor, the different toxins are there, but the one important thing is your alpha toxin. Alpha toxin is the most virulent one. This is the main factor. This is the main factor. So what does it has? This has some property called alpha. This one has a property called alpha toxin, lecithinase. Lecithinase or phospholipase. Phospholipase C activity. So this is the main virulence factor. This one, it causes what? Alpha toxin is the one that causes clots. It causes clots in the blood vessel. In blood vessel, that would lead to clot in the blood vessel. Clots in the blood vessel, which leads to different type of what? Necrosis. Necrosis, that means it will lead to gangrene. It will lead to a lot of gangrene. Okay, this is the thing. There's clots in the blood vessel that leads to gangrene. So the disease name is, what is it? It's called gas gangrene. It can cause gas gangrene and food poisoning. Two diseases it causes. When you talk about the disease, it causes food poisoning. It can cause food poisoning, also gas gangrene, two diseases. But gas gangrene is the most dangerous one, right? The detail we'll talk in a while. We have a separate question of that. But here when you write gas gangrene, you're going to write usually after road traffic accident. Usually after road traffic accident. Crush injury. Whenever there's a crush injury, then what happens? The spores start to, and if there's it creates an anaerobic environment, right? The spores there, it will develop into, causes the spores there will causes the infection. They will develop into the vegetative form and infection happen. So infection, you will have a typical gas gangrene will be there. So gas gangrene is basically, you will have severe pain plus crepitous pain, crepitous will be there, plus discharge. There will be discharge also, very foul smelling discharge. Okay, foul smelling discharge will be there. This is the simple feature if you want about the pathogenicity and the clinical features of Clostridium welchi. This only. Okay, that's it. This only you're going to mention. Now we're going to the other thing. Yes, apart from this, it causes many necrotizing anything necrotizing in a body. Most of the necrotizing, which Clostridium welchi only causes. Okay, right. Now we're going to another question, important question, that is our laboratory diagnosis. Laboratory diagnosis is very unique here. Laboratory diagnosis of Clostridium welchi. So here what to do is, first of all, every time we talk with, we'll speak about the microscopy only. Here we'll talk about the microscopy, and then we'll talk about the culture media. culture media, and then we are going to talk about the culture media, and then we are going to talk about the biochemicals. We have a lot of important biochemicals and special tests we have. Okay, biochemicals and special tests. So in microscopy, what you're going to do, you are going to do a gram stain. When you do a gram stain, of course, you know these are gram positive. It comes in the McDonald's gram positive. So you will be seeing what? You will be seeing this. Okay, this spores will be subterminal, but especially in gas gangrene, sometimes there will not be spores. Okay, so in gas gangrene, mostly you will not see spores. So basically, you're going to write this looks like what? It looks like a boxcar appearance. So you're going to write, you will have boxcar appearance. Boxcar appearance, gram positive bacilli. Gram positive bacilli. Okay, if spores are seen, usually don't see in gas gangrene, but if spores are seen, it will be club shaped. Club shaped spores. That's it. Okay. Boxcar, spores in club shape. This much only. Okay. Now, culture media. Culture media, you know, any Clostridium, we are using which media? Robertson cooked meat media. Robertson cooked meat media. Very, very important. You should know Robertson cooked meat media. Cooked meat media or thioglycolate broth, TGB, thioglycolate broth. Okay, this is the culture media. Okay, now biochemicals. We talk about biochemicals, a lot of important tests. So one test is which is called reverse camp. The reverse camp test will be positive. Number one. Number two, it forms a, there is a sign called target sign. We'll talk about target hemolysis, we call target hemolysis. Okay, and then also there is a litmus milk fermentation. Litmus milk fermentation. And also something called Naegler's reaction. Naegler's reaction. Everything is very specific. Everything is 1 mark question also. Okay, so you have to know everything very, very carefully. When talk about the reverse cam, this title, if you write itself, you will score half of the mark. In reverse cam, basically what you do is that in the blood agar plate, in reverse cam, in a blood agar, you take a blood agar plate. Okay, then you have to put a central streak and side you will put something else. Okay, so here you have to see what? An arrow. You should see a arrow. That is the thing, reverse cam. So basically what to do, usually normal camp, you're putting staph aureus in the center. Here you're going to put a Clostridium perfringens only. Clostridium perfringens in the center. The side, as usual, your Streptococcus agalactiae. Agalactiae you will put, okay, streak. And when you put what you see, you will see an arrow. You will see an arrow or butterfly, whatever, okay. Arrow is seen. Arrow shape thing is formed here like this. So if that is positive means then it is positive. That's what we call reverse. Usually the staph aureus will be there. Here we are not putting staph aureus, we are putting Clostridium perfringens itself. So that's what. If you remember, Streptococcus agalactiae gives the direct cam positive. Here, because Clostridium perfringens in the center you're seeking, you call reverse cam. That's it. Very simple. Okay. Target hemolysis is basically what happened in the blood agar. The colonies, if you see, you will have 2 zones of hemolysis. That's like a target. No, it's like a target. So this is called double zone or target hemolysis. Double zone or target hemolysis. Very, very simple. Litmus milk fermentation, one special thing only for Clostridium welchii you see. Naegler's reaction is basically a neutralization reaction. You just have to write neutralization reaction, characteristic for your Clostridium. Neutralization reaction. We will talk about in detail the separate question Naegler, then we'll talk. So this much is the basic thing you're going to write in the lab diagnosis. More than sufficient. If you explain, you will get good mark for this. Okay, that's all. Now, next question. We're going to the next question. Yes. Now, yeah, so everything explanations are given here, so you don't have to worry. You can see the questions here. Clostridium full, all the things mentioned very clearly, detailed. Clostridium perfringens, okay, everything. Yeah, now 1 second. This is a gas gangrene. Gas gangrene, if you written, we have one more question also, gas gangrene. Yes. So same thing. So see here they specifically mentioned here, you have to follow previous question I wrote. Gas gangrene, they mentioned, they told, write the etiopathogenesis, laboratory diagnosis, treatment, and prophylaxis. That's what I came separately here. So gas gangrene, when you talk about the etiopathogenesis, first of all, they asked etiopathogenesis. So when they ask about etiopathogenesis, gas gangrene, remember, not just only your Clostridium perfringens is the most common cause, or welchii, Clostridium perfringens or welchii. This is the most common one, but other things also there. Clostridium novi, and also Clostridium septicum. septicum. Okay, shortcut, remember PNS. PNS, you remember PNS. Okay, this there. Now, what is another important thing? The pathogenesis, they say the main culprit is the alpha toxin. Alpha toxin is basically called lecithinase. Lecithinase or phospholipase. Okay, we call. So this is the one which is causing all problem. What it is causing? It is causing the clots. It causes the clots in blood vessel, clots in blood vessel. So that means you will have clots in the blood vessel, means definitely what happens, there will be ischemia. Ischemia means if there will be no oxygen, so then this if no oxygen, then you know what happened, it ends in the necrosis, right? So necrosis, when you have necrosis, what happens now? Because of necrosis, now clinical future. So now what happened in clinical future, because of one more thing also, before going to clinical future, we have to talk something else. This is only toxin we have spoke. Now, risk factor. So risk, who are on the risk? Patients who had what? RTA, road traffic accident or crush injury, even any blunt injury also, doesn't matter, any penetrating injury or whatever. In these cases, injury, what happened? So there is an anaerobic environment. Anoxia will be there, no, because of blood vessels or blocked anoxia. So there is an anaerobic environment. Anaerobic environment. So when an anaerobic environment is there, the spores of Clostridium, what happened? They develop into the vegetative form, and then they cause the infection, severe infection, releasing those toxins, alpha toxins, etc., and they cause severe infections. So because of this, what happened? Clinical future, what you have, because of severe necrosis, what you will see, you will basically see what are things you see clinical feature: severe pain, excruciating pain. You see, because it's a gas gangrene. Now, clinical feature of, we're talking about gas gangrene. Gas gangrene will have severe pain, crepitus, because it's a swelling. So if you touch it, there will be the crepitus sound. Also, foul discharge, foul smelling discharge will be there. These are the characteristic things you will see. Okay, severe pain, crepitus, and foul smelling discharge. Very, very simple. Okay, that's all. So this is the thing. So this is the clinical feature you're going to write. Now what happened? Next question you see, they asked about the treatment. The lab diagnosis is same. Lab diagnosis, I will tell you just previously whatever we told. That means what? We are going to see the microscopy you will do, and then culture, Robertson cooked meat media you will do, and then after that you will see all the target hemolysis, Naegler's reaction, Naegler's we just spoke, litmus reverse camp, all these things, whatever you spoke before, you want to write. Okay, now treatment. For treatment, you know that it's already gangrene. So the main treatment should be what? The main treatment, what you have to do is that, and it's an anaerobic environment and severe necrosis, so you have to debridement, wound debridement. And you can use hyperbaric oxygen therapy, hyperbaric oxygen, because it's anaerobic. If you put oxygen, the Clostridium will automatically get killed. So hyperbaric oxygen debridement of the wound surgery, and then hyperbaric oxygen therapy. And of course, you can use any of the metronidazole or penicillin also will work. Penicillin also will work to kill this bacteria. That's it. Okay, that's it. The prophylaxis, of course, prophylaxis you have to give anti-serum only. Anti-serum, anti-perfringens serum will be helpful in prophylaxis. That's it. Nothing much. Okay. So these are the three things very important when you're talking about a gas gangrene, you have to know. That's all. Okay. Very, very simple and easy question. Now, next question. This one, Naegler's reaction. Naegler's reaction. Oh, okay. I'm just going to write here. Okay, it's fine. We have mentioned here only, no problem. Naegler's reaction. We just told that Naegler's reaction means N for N. So remember, neutralization reaction. Okay, it's a type of neutralization reaction. What you do is that you take which agar, you took the egg yolk agar, you take, the idea is it's a neutralization test first you're going to write, then how to do the procedure. You take an egg yolk agar, okay, or some human sera containing media, okay, 20% human. So you take the egg agar, and then what you do is that, see, on one side, you have a normal one, and one side we have an antitoxin. Okay, so whenever there is a toxin, what happen? You will have around this colony. This is called around this colony. What you see? You see an opalescence. You see opalescence in normally. Okay, normal. When you streak on the egg yolk agar, but But if you put antitoxin, this is in the normal one. But when there is antitoxin, then what happened? There is no opalescence. See, this opalescence is inhibited. Okay, when the antitoxin is there, so here what happened? Opalescence is inhibited. That's it. That is because of this opalescence inhibited, right? This is because of what? Your antitoxin. The reason is because of antitoxin. That's it. If you see this reaction, then that is characteristic for your Clostridium perfringens. That's it. This is the one. Okay, so you can have question here also. This is also question. For Naegler's reaction is characteristic for perfringens. Whatever reaction, it's a neutralization of toxin, antitoxin, toxin and antitoxin, toxin and antitoxin reaction. Very, very simple. Short notes. Okay, Naegler's could be a short notes and easy. You will do it. Sure, no doubt in it. Okay, now next. Yeah. Now, Vincent's angina. Okay, Vincent's angina. It looks like, angina, but not a heart angina. It is the angina in the mouth. That's called Vincent angina. Okay. So, yeah, in Vincent angina, it is first of all etiology. Etiology is it's usually caused by which are the bacteria. One is your Borrelia Vincenti. Borrelia Vincenti. Remember Borrelia Vincenti. Borrelia burgdorferi, which causes the Lyme disease. But this Borrelia Vincenti is an oral flora. This one thing. Apart from this, there's something called fusobacterium, right? Fusobacterium. And not only that, there's something called Prevotella. But main is Borrelia Vincenti. The name itself says, okay, Vincenti, okay, Fusobacterium, Borrelia. They all are normal oral flora. They are basically normal oral flora. Okay. Now, what it causes? Clinical feature, if you see this one, they basically cause, what it causes? It causes necrotizing gingivosomatitis. Gingivosomatitis. Okay. That means in oral cavity, they are causing this lesion, necrotizing gingivosomatitis. Very dangerous mouth and everything. And Vincent angina, we are talking in the mouth region only. Okay, you will have this gingivosomatitis. So because of this, what happened? There will be foul smelling. Of course, foul smell from the mouth. You will have bleeding also, bleeding from the gum, and also taste. No, the very abnormal taste. Okay, abnormal taste. Okay, so these are the features you will see. Now what happened? How to diagnose this one? For this diagnosing, nothing to do. You have to check for the, we know Borrelia is a spirochete. So you check for, you take a swab and then make a smear. Under microscopy, you have to see for this spirochetes or the fusiform bacterium. Okay, fucibacterium or fusobacterium or fusiform bacterium. Fusobacterium and fusiform, all same only. Okay, same. Spirochetes of fusiform bacteria, you will check. That's it. This one you see and identify. And of course, treatment you can give for mainly only smear, nothing else. Etiology and laboratory diagnosis means you're going to write only the smear, microscopy. You check for spirochetes of fusobacteria. Okay, that's it. So treatment you go with the metronidazole, and if surgery needed, metronidazole. And if surgery needed, it will be done accordingly. And when I say this necrotizing gingivosomatitis, it forms, the membrane is like a pseudomembrane. It is very similar to diphtheria. Okay, it looks like a diphtheria, but it doesn't bleed. Okay, so pseudomembrane in the mouth cavity, oral cavity. So this is characteristic for your Vincent's angina. Very, very simple, easy. Okay, so already explanation is given here. You can go through the explanation once. Okay, everything is mentioned very clearly here. Okay, yes. Now, Lapremin test. Lapremin test is one question. Directly, you have to, if it's a short note, you're going to get the full mark because it is it's very important. You are Lepermin is usually asked frequently. Okay. So now, first of all, what's a Lepermin test? It is a type of hypersensitivity test. It's a hypersensitivity type 4 reaction. Yeah, hypersensitivity reaction type 4. So basically, it's a delayed hypersensitivity reaction. We call it as delayed hypersensitivity reaction. Number one, first point. Second one, Lapremin test, you should know that it is not for diagnosis. It is not for diagnosis. You have to write this, not for diagnosis. It is to check immune status. It is to check the immune status of the host. It is to check the immune status of host. That's it, to check the immune status of the host. Got it? Now, next one. Now there are two types. What is the procedure? The procedure now, basically what you do, you have to inject in procedure, you just have to inject lepramin, inject lepramin protein in the arms. Okay, in the arm, you'll inject it and then you have to look for the changes. So how do you classify the changes? Into two things. So this one will be two things. What are the two things? One is early, other one is late reaction. You have to like two times you have to see. One is early, another one is late. Early reaction is called early Fernandez. Early reaction is called Fernandez. Late is called Mitusuda. Mitusuda reaction. Okay, LM. So after E comes F, easy. Other one late LMN. Okay, LM. Okay, after L comes M. Okay, so Mitusuda. So you remember like that. Okay. Now, what you have to watch for? If it is early reaction, you have to look for an induration. Arithmetic, you write there. I won't write here. Arithma induration. E for E, it will be easier. Arithma induration, which should be more than 10 mm. Here, it should be more than 5 mm. Nodule, you will see. Latest nodule. So the shortcut is LMNC. You got all the word L and M. Okay, very simple. So now what you do, induration more than 10, late Mitusuda nodule more than 5 mm. So this is fine. Now what happens if the test is positive means patient is having good immunity. Patient has good, one second, it should come here. Yeah. Okay, patient has good immunity. If it is negative means the patient has poor immunity. So good immunity is example is usually TT type of leprosy. LL type has a poor immunity. So that's what it is. Very prognosis very, very bad. Okay. So this is the lepramin test ka, whatever you want to write. Okay. Very, very simple. So you know this one. Okay. So if you forgot or if you couldn't get also, it's here. If you explained it very clearly here also, you can see. Now last one is define cultivation laboratory diagnosis of your Mycobacterium leprae. Okay. Mycobacterium leprae. They told you to cultivation and the lab diagnosis. Basically, they ask lab diagnosis. Okay, basically, it's the lab diagnosis of Mycobacterium leprae. So first one, we always start with the microscopy. So if anything in micro, you have to start with microbe. You start with microscopy only. Okay, microscopy first. Yeah. In microscopy, what you do is that which one we are going to do? We have to first of all check the smears. What are the smears we are going to have? So sample the specimen. So the specimen would be first of all. First one is you do slit skin smear. That means you're going to take the entire tissue, you punch it and take the tissue completely. So you're going to take you take 6 smears you're going to make. How? 4 from skin, in the skin part, 1 from the nasal, and 1 from the earlobes. Okay, you should make this, you should take the slit skin smear from 6 smear from 6 sides. Okay, but from the 6 sides you have to make the smear. Okay, all this 4 skin, 1 nasal, 1 nasal, and 1 earlobe. Second one is biopsy. Biopsy of the nerves. You have to do the biopsy of nerves. Which nerves? Commonly used is the radial nerve or sural nerve. Radial or essiosural nerve, your leg nerve. Okay, these two nerves you biopsy. Or sometimes you can do this nasal tissue. You can use the nasal mucosa also. Nasal mucosa, scraping or whatever you can do. But this is more the specimen. Okay, now what you do, what is the stain you're going to do here is, you're going to do the ZN, that is acid fast staining, modified acid fast staining, where you're going to use only 1% H2SO4. Remember, this is very important. Sorry, you're going to use 5% H2SO4. 25 is normal for TB. 5% is for your leprosy. 1% is for, we have a lot of things, cryptocyclo, isonocardia, all those things. Okay. So 5% H2SO4 you use. And if you do typical acid fast in carbolfucsin, methylene blue, you do. So what you will get is that you will see, you see the bacilli like this. One place. Okay, in a back with a background like this, with the background like blue color methylene background puzzles, you'll see. So that this is called as, what you call it as, this is called as globi or cigar bundle appearance, or cigar bundle appearance. Okay, this is the first microscopy. You're going to write it all detail like this. You have to write all these things for microbiome leprae. Okay, then next one, culture. You told cultivation. Cultivation, basically, we're going to write as culture. In culture, remember very carefully that you know very well, there is no artificial culture. There is no any artificial culture. You have to use only the animal culture. So you use only animal. So animal, which one you are using? Though we don't use it, but for exam purpose, you should know. Animal, which animal? One is your nine-banded armadillo, which is very difficult to get. So usually we end up with foot pad of mice. Foot pad of mice is better one. Okay, foot pad of mice, this thing. Nine-banded armadillo and foot pad of mice are the most commonly used animal for cultivation of your leprosy, microbiome leprae. That's all. These are the two things you can do for me. We have some serology to identify some antibody and all, but that's not that significant. Okay. And of course, lepromin test is not for diagnosis. It is for the check the cell immunity of the patient. So you don't need to write about that as lepromin test here. Okay, that's all. So now, so everything is mentioned, whatever we spoke, details. So this how this looks like, the smear. If you see here, this is how this is called the globi or sugar bundle or globi appearance. Okay, and then this is the armadillo, nine-banded armadillo. Now, almost the end question, I think. We came to the this is cutaneous anthrax. The last question, cutaneous anthrax. Cutaneous anthrax or Hyde-Potter's disease. Okay. Now the disease is called Hyde-Potter disease, which is basically the cutaneous anthrax. Cutaneous anthrax. If you remember, this is the most common. This is the most common type of. This is the most common type of anthrax. Most common type of anthrax, right? Cutaneous is the most common type of anthrax. Then first one is the etiology. It's caused by which one? You know, that is the Bacillus anthracis. It is caused by Bacillus anthracis. Okay. Now, risk. Who all are under the risk? The name itself says you very clearly. Hyde-Potter means who's handling animal handlers. Usually it's common with the animal handlers. Animal handlers. That means which includes the porters, abattoirs, okay, and dock workers, butchers. So whoever is exposed to animal, they are high risk of getting this one. So that's the first point you went right. Okay. Now, what happens then? The spores spores is the main reason. It enters through the abraded skin or whatever. It enters into it affects the skin and it causes the anthrax. Okay. Now, clinically, what you will see in the clinical. In clinically, what you expect to see is that you will be seeing a initially you'll see a painless. First of all, you see painless vesicle. There is no pain at all. Okay, so see, this prognosis is very good for cutaneous anthrax. Not the pulmonary is a dangerous one, which is ulcerative disease, which is more dangerous. Okay, can use for bioterrorism also, but cutaneous is not at all dangerous. Just a painless vesicle, which becomes what? It becomes turns into a black eschar. It's called a black eschar. That is basically necrotic tissue. It's called black tissue, which is a necrotic tissue, painless. So this is one, usually we call it as a malignant pustule. This is also one mark question. Everything is one mark question. Malignant pustule. Okay, malignant pustule. This is very malignant pustule is usually, it's not, the name is malignant, looks like that, but it is not fatal. It is not fatal. It's good only. Okay. So the prognosis is usually good. After treatment, prognosis is very good after treatment. Okay. So no, not like pulmonary anthrax, which is very dangerous. That's it. This much, if you write point by point, it's more than enough. Okay. 5 mark, 5 points, easily you'll get it. Okay. That's all. This is about the cutaneous anthrax. So that's all. We came to everything is here also. You can go to the points I mentioned here, everything. Okay. It's not malignant. Everything is clearly mentioned here. Okay. So that's all. So this is for today. I hope it is okay. So further till next class. Bye for now. Okay. Good night.